Right now, take off one sock. Just one. Look at the skin where the elastic sat all day. If you see a clear indentation pressed into your calf, a groove that stays there for 30 seconds, a minute, sometimes 5 minutes before the skin finally smooths back out, I need you to keep watching, because what you're looking at is not a sock problem. It's not a salt problem. And despite what almost every person over 60 has been told, in 70% of cases, it's not a heart problem either. This is a drainage problem, and the organ responsible is the one nobody ever bothered to explain to you. The water sitting in your legs right now, maybe half a liter, maybe a full liter, has been pooling quietly in the tissues around your ankles and calves while you sat all day today. And tonight, when you lie down, that water is going to do something to your body. It's going to destroy your sleep. It's going to wake you up 2, 3, even 4 times every night to urinate. And it's going to force your heart to work overtime at the exact moment it needs rest the most. I'm Ethan Cole, and I understand this not just as a cardiac surgeon, but as someone who lived with it for 15 years. 15 years standing in the operating room, surgeries lasting 6 to 8 hours, standing in one spot, unable to leave my position, unable to sit down while holding a scalpel in my hands. I came home with legs that felt like 2 concrete pillars. The marks from my surgical shoes pressed deep into my ankles. I thought that was just the price of the job. Then I started noticing I was waking up 3 to 4 times every night to urinate. And I realized something medical textbooks never taught. The fluid in my legs during the day was pouring back into my bloodstream at night. My heart had to pump that extra volume. My kidneys had to filter that extra volume. And I, a cardiac surgeon, was silently adding burden to my own heart every single night without knowing it. And here's what frustrates me about how medicine approaches this problem. Millions of people over 60 walk into clinics with swollen legs. They get asked about their heart. They get told to cut salt. They get prescribed a diuretic, a water pill that makes them run to the bathroom all day. And for some people, it helps a little. But for most people over 60, it does almost nothing. Why? Because the water was never in the bloodstream in the first place. The water was in the tissues, and a diuretic cannot reach tissues. It can only pull water out of blood. You've been treating the wrong compartment. Today I'm going to show you what most doctors don't explain. Why your swollen legs are the culprit waking you up to urinate in the middle of the night, and a simple 5-minute habit that can drain all that fluid before you get into bed. When I applied this routine, I went from 4 times down to once per night. Many of my patients have achieved similar results in just 2 weeks. Stay with me. First, you need to understand something, because it explains why diuretics don't help you. Your body has 2 drainage systems, not one. Most people only know about the first. The first system is blood. Arteries carrying fresh blood out, veins carrying used blood back. This system has a pump, your heart. It runs automatically every second of your life, whether you help it or not. The second system is the lymphatic system. And here's what nobody ever sat down and explained to you. It has no pump. None. Zero. Your lymph is a clear, pale yellow fluid that constantly leaks out of tiny blood vessels in your tissues, bathes your cells, picks up cellular waste, dead bacteria, excess protein, and excess water. Then it has to be returned to the bloodstream through a completely separate set of vessels called lymph capillaries and lymph ducts, about 2 liters every single day. But those lymph vessels have no heart attached. They only move when you move. Think of your lymphatic system as a conveyor belt that only runs when you step on it. Every step you take, every calf muscle contraction, every ankle flex, squeezes the lymph vessels and pushes fluid upward. Stop moving, stop draining. Sit for 3 hours and the belt stops completely. The fluid just sits there in your ankles doing nothing. When you're 30 years old, this isn't a serious problem. The lymph vessels are elastic. The valves inside them are tight and working well. A single walk across the parking lot restarts the whole system within minutes. But after 60, 3 things change at once. First, the lymph vessels stiffen. They no longer contract as flexibly as before. Second, the valves inside begin to leak. These valves are supposed to prevent fluid from flowing back down. When they weaken, the fluid you just pushed up partially slides back down. Third, the connective tissue around your ankles, the cushioning that holds everything in place, starts losing elasticity. It becomes looser, able to hold more fluid. The result is fluid leaks out faster, but the drainage system moves slower. The math no longer balances, and the reservoir on your ankles keeps growing. Research shows that after 60, the drainage speed of the lymphatic system drops by about 40% compared to when you were 30. This explains why leg swelling becomes far more common at this age, even when your heart is perfectly healthy. But before I go further, I need to make one thing clear. There are cases where ankle swelling is not a lymphatic issue, but a true medical emergency. You need to recognize these situations. Stop this video and see a doctor today if any of the following applies to you. One leg suddenly becomes noticeably more swollen than the other within a few hours, along with pain, warmth, and redness. That could be a blood clot in a deep vein. Dangerous. Needs immediate evaluation. Both legs are swollen, and you have difficulty breathing, especially when lying flat. You wake up in the middle of the night, gasping for air. You cannot climb one flight of stairs without stopping. Those are signs your heart is overloaded, not something to handle at home. Swelling along with sudden weight gain, 4 to 6 pounds in 1 week, and foamy urine. This combination suggests your kidneys are leaking protein. Needs blood work this week, not next month. Swelling on only one side, painless, firm to the touch, in someone with a history of cancer treatment in that area. That could be lymph node blockage that needs evaluation. If none of the above describes you, if your swelling comes on gradually, affects both sides equally, is worse in the evening, better in the morning, and you have no shortness of breath at rest, then what I'm about to share is meant for you. There are essentially 3 patterns of chronic leg swelling after 60. They look the same to the naked eye, but they have completely different causes. The first pattern is venous. Your veins are struggling to return blood to the heart. The valves inside the veins have failed. Blood pools, pressure builds, and water gets pushed out through the vessel walls. You typically see visibly dilated veins, brownish discoloration on the shin just above the ankle, and swelling that gets noticeably worse after a day of standing. The second pattern is lymphatic. This is what we're focusing on today. Lymph flow has slowed down. Tissues are saturated with water. The swelling is soft, leaves a dent when you press on it, feels puffy rather than tight, and often extends to the top of the foot, the area just behind the toes. When lymphatic swelling persists for years, the skin on top of the foot becomes so thick that you can no longer pinch it between 2 fingers. That's a clinical sign called the stemmer sign, and it points directly to a lymphatic problem, not a venous one. The third pattern is cardiac or renal. Your heart or kidneys cannot handle the fluid volume in your body. Swelling is symmetrical on both sides, worsens throughout the day, and importantly, it comes with other symptoms. Shortness of breath, waking up multiple times to urinate, extreme fatigue, rapid weight gain. If you have those accompanying symptoms, you fall into the third pattern, and that's not something to manage at home. You need to be examined. Most people over 60 with chronic evening ankle swelling and no other symptoms fall into the second pattern, lymphatic. Let me tell you about a patient I'll call Margaret. Margaret, 67 years old, retired librarian from Portland. She walked into my clinic convinced her heart was failing. Her story went like this. For 2 years, her ankles had been thickening every evening. At first, just a little, then to the point where she could no longer fit into the shoes she had always worn. She bought wider shoes. The swelling kept progressing. She mentioned this during a routine checkup and was sent for an echocardiogram. The result, her heart was completely normal. Ejection fraction, the percentage of blood the heart pumps out with each beat, was 60%. Perfectly healthy. But Margaret was still swelling. She was prescribed a diuretic. She took it for 6 months. She ran to the bathroom constantly all day. Her ankle swelling barely changed. She was exhausted, dehydrated, and still swollen. Then she said something that unlocked the whole picture. The strange thing is, when I go traveling and walk all day, my ankles actually get better. That was the clue. Her swelling improved with movement. Her swelling worsened with sitting. Her heart was normal. Her kidneys were normal. A venous ultrasound showed only minor age-related changes. What Margaret had was a lymphatic drainage problem, something no pill could fix because the fluid was never in her blood. It was in her tissues. Here's what happened in Margaret's body every single day, and possibly in yours. She woke up. Her ankles looked slim. She had been lying flat for 8 hours. Gravity wasn't pulling fluid down into her legs, and her lymphatic system had all night to gradually drain the fluid that accumulated the day before. By morning, she was almost back to normal. She got up, ate breakfast, sat at the kitchen table for an hour, sat in the car for 20 minutes, sat reading or watching TV for 3 hours, ate lunch, kept sitting. By 2 in the afternoon, she had been upright but nearly motionless for 7 hours. During that entire time, fluid was constantly leaking from capillaries into the tissues in her lower legs. Her calf muscles barely contracted. The lymphatic conveyor belt barely moved. Fluid just kept accumulating quietly, spoonful by spoonful, into a reservoir she couldn't see. By late afternoon, the sock marks appeared where the elastic pressed in. By 9 at night, her ring started feeling tight. By 10 at night, she lay down and the real problem began. All that fluid pooled in her ankles, now that gravity was no longer holding it down, began slowly reabsorbing into her bloodstream. Her heart received an unexpected surge of volume. Her kidneys detected rising blood volume and shifted into high gear, producing urine. She woke up at 2 in the morning to urinate. It happened again at 4 and again at 5. By 6 in the morning, she was exhausted, and the cycle started all over again the next day. This is not speculation. A study from Japan published in the Journal of Urology found that in people over 60 with leg swelling, nighttime urine volume was 40% higher than daytime, and most of that nighttime urine came from leg fluid being reabsorbed when they lay down. In other words, swollen legs during the day are why you wake up to urinate at night. So how do you know if you're in this situation? 2 tests. Right now, 30 seconds total. The first test, the pit test. Find your shin bone, the bony ridge running down the front of your lower leg. Place your finger about 4 inches above your ankle. Press your thumb in firmly. Hold for 15 seconds. Lift your finger and look. If there's a visible dent that takes more than 10 seconds to flatten back out, you have what doctors call pitting edema. Grade 1 is a shallow dent that fades quickly. Grade 2 is a deeper dent that lasts longer. Grade 3 is a deep dent that takes more than a minute to flatten. Remember what grade you're at. You'll test again after 2 weeks of applying this routine, and the change will be measurable. The second test, the foot skin pinch. Try to pinch the skin on top of your foot just behind the second toe between your thumb and index finger. If you can easily lift the skin into a fold, your lymphatic system is circulating. If you cannot lift the skin, it feels stuck to the bone underneath. You have long-standing lymphatic congestion. This is called a positive stemmer sign, one of the simplest clinical indicators that lymph has been backed up for a long time. You now have 2 important pieces of information about your condition. Hold on to them. We'll come back to this after 2 weeks. If you're also waking up 3 to 4 times every night to urinate, comment, "I wake up 2 below." You're not alone, and what I'm about to share could change your sleep. If you're finding this video helpful, hit the like button right now. It helps this video reach other people who are struggling with the same problem every night. And if you haven't subscribed to this channel yet, do that and turn on notifications. We're here every week with science-based guidance made specifically for people over 60. Now, before I walk you through the 5-minute routine, you need to know what's making your leg swelling worse every single day, and you might not even realize it. Most people over 60 do all 3 of these things every day without realizing it. The first, hidden sodium. Not the salt shaker on the table. It's the sodium hiding in things you wouldn't expect. Cheese, bacon, canned soup, bread, sauces, restaurant food, frozen meals. Sodium pulls water out of blood vessels and pushes it into tissues. Your body holds on to about 4 cups of water for every extra gram of sodium. Most Americans over 60 consume double the sodium they think they're eating. The second, sitting after dinner. The hours between 7 and 10 at night, when you finally get to relax on the sofa, are exactly when your legs absorb the most fluid. 3 hours of sitting motionless after the biggest meal of the day creates the worst possible conditions for nighttime reabsorption. The third, alcohol. Even 1 glass of wine in the evening dilates your capillaries, speeding up the rate at which fluid leaks from blood vessels into tissues. At the same time, alcohol suppresses antidiuretic hormone, the hormone your brain uses to tell your kidneys to slow down at night. 1 drink, and your ankles will be noticeably more swollen the next morning. Those 3 things are working against you every single day. Now let's talk about what can help. The first, water. This sounds counterintuitive. Most people with swollen legs drink less water because they think more water means more swelling. The truth is the exact opposite. When you're dehydrated, lymph fluid becomes thick and hard to move. When you drink enough water, lymph fluid thins out and flows more easily. Simple formula. Take your body weight in pounds, divide by 2. That's how many ounces of water you need each day. Spread it throughout the day and taper off after 5 in the afternoon so you're not waking up to urinate because of drinking water instead of because of leg fluid. The second, flavonoids. These are natural compounds that strengthen capillary walls and reduce leakage. The best sources are dark-colored berries, blueberries, raspberries, strawberries, buckwheat, citrus peel, red cabbage. 1 cup of berries per day has a measurable impact on capillary strength after about 8 weeks. The third, protein. This surprises many people. Albumin, a protein in your blood, has the job of keeping water inside blood vessels. When albumin is low, water leaks out into tissues and stays there. Many people over 60 have mild protein deficiency without knowing it. 2 servings of quality protein per day, eggs, fish, chicken, lentils, cottage cheese directly improves your body's fluid balance mechanism. The fourth, magnesium. Deficient in most people over 60. Magnesium affects smooth muscle tone, including the walls of lymph vessels. When magnesium is low, lymph vessels contract more weakly. The easiest food sources are pumpkin seeds, dark leafy greens, and almonds. Those 4 things support your lymphatic system from the inside. Now the most important part, the 5-minute daily routine that drains fluid before you get into bed. This is the core of the video. Every step matters. Morning, before your feet touch the floor, when you first wake up, while still lying in bed, do 30 ankle pumps. Point your toes down, then flex your feet up toward your face, 30 times. Takes about 45 seconds. This restarts lymph flow after 8 hours of lying still and prevents fluid from rushing down into your legs the moment you stand up. During the day, every hour you sit, do 20 calf pumps. Keep your heels on the floor, lift your toes up, then back down. Or if you can stand up, do 20 calf raises. Lift your heels up, then lower them down. Takes 30 seconds. Set a timer if you tend to forget. This keeps the conveyor belt running throughout the day, never giving fluid a chance to accumulate. Before dinner, not after dinner. 5 minutes of slow walking. Not exercise, just movement around the house, around the yard, around the block. Walking activates the deep muscles in your calves in a way that seated ankle pumps cannot. Evening, 90 minutes before bed. This is the most important part. Lie on the floor or on your bed. Place both legs straight up against the wall, creating about a 90-degree angle. Heels higher than hips, hips higher than heart. Hold this position for 15 minutes. During those 15 minutes, do the following movements. Slow ankle circles, 10 rotations clockwise, 10 counterclockwise. Alternating ankle pumps, flex and point, 20 times. For the last 3 minutes, place both hands on your belly. Breathe deeply through your nose, letting your belly rise. Exhale slowly. Why does belly breathing matter? Because it activates the thoracic duct, the main drainage channel for your entire lymphatic system, located right behind your diaphragm. Every deep belly breath is 1 pump cycle for lymph fluid. After 15 minutes, slowly roll to one side and sit up. Then do one simple but effective thing. Use your palms to gently stroke from your ankles up to your knees. Slow, gentle, always toward the heart. Never stroke downward. 10 times on each leg. This is a simplified version of a technique called manual lymphatic drainage. It pushes fluid from tissues into lymph capillaries. Right after completing this routine, you'll need to urinate. You'll release about 10 to 14 ounces of pale urine. That's the fluid that would have woken you up at 2 in the morning. You just drained it while you were still awake and in control. A study from Nagasaki University in Japan found that elevating the legs for 15 to 20 minutes before bed reduced average nighttime urination from 3.2 times down to 1.5 times, a reduction of more than 50%. Margaret followed this routine for 3 weeks. By the end of the first week, the sock marks were gone by morning. By the end of the second week, she was no longer waking up to urinate at night. By the end of the third week, her ankles at 9 in the evening looked as slim as they did at 9 in the morning. Her echocardiogram didn't change. Her prescriptions didn't change. She had already stopped the diuretic because it never really helped. What changed was that her lymphatic system was given a work shift at the right time. Amigo, instead of being forced to work overtime all night while she was trying to sleep, you understand the mechanism and you know the routine. Now it's time to take action. 5 things to do starting tonight. 1. Do the PIT test right now. Know what grade you're at. Write it down. 2. Cut one hidden sodium source starting tomorrow. Cheese, bacon, or canned soup. Pick whichever one you eat the most and replace it for 2 weeks. 3. Before dinner today, walk for 5 minutes. Not after dinner, before. 4. 90 minutes before bed, legs up the wall for 15 minutes. Deep belly breathing for the last 3 minutes. 10 upward strokes on each calf when you sit up. 5. Tomorrow morning, 30 ankle pumps before your feet touch the floor. Do this for 2 weeks. Test the pit test again. You'll be surprised by the change. One last thing. If someone you love has swollen ankles every evening, send them this video. They've almost certainly been told it's a heart problem. They've almost certainly been given a pill that doesn't address the real mechanism. You can give them the explanation nobody ever bothered to provide. Your ankles are not betraying you. They are a drainage system that stopped receiving the signals it needs to function. Give it 5 minutes a day, and the difference is not small. It's the change you see in the mirror, feel in your shoes, and recognize on the first morning you wake up without pressing your finger into your calf to check. Before you go, leave your name, your age, and the health issue you're dealing with in the comments. That helps me know what the next video should cover to serve you better. If this video was helpful, hit the like button and subscribe to the channel. We're here every week with guidance made specifically for people over 60. I'm Ethan Cole. Take care of your body. It's the only home you'll ever have.